Welcome to Drug Error Talk. Today we're discussing the drug Nexium, how it affects the human body, how errors can be made with Nexium, the consequences of those errors, and what should one do if one sees those errors. I'm joined today by Dr. Jesse Garcia. As you may know, I'm Matt Hamilton. I'm a trial attorney specializing in drug errors. But Dr. Garcia, what is your area of specialty?
I am a clinical pharmacist. I specialize in drug interactions and the effects on the human body.
I see. We're talking about the brand name Nexium. Does it have a generic?
Correct. It does have a generic, and its name is esomeprazole.
Esomeprazole.
Correct.
It's quite a mouthful.
Yes.
So if someone's taking esomeprazole or Nexium, how does that affect the human body?
It is in a class of drugs called proton pump inhibitors. What they basically do is they're going to shut down the acid-producing pumps that you have within the stomach that are activated by food.
Okay.
And so we shut those pumps down, and then you are relieved of some of those acid reflux symptoms because you don't have as much acid in the stomach.
With Nexium, can errors be made?
Absolutely. Nexium is not free from error. Some of the ways that we see this are going to be its improper usage. And what I mean by that is either the patient, if they're purchasing it over the counter, or they are directed to take it by a physician, may not be told that they need to take it anywhere from 30 minutes at a minimum to up to an hour before they have their first meal of the day.
Okay.
And the reason for that is you want to go in and basically shut the pumps off that are producing the acid prior to eating, because the eating thus activates or helps activate the pump system to produce the acid. So it's much easier to continue to keep the pump shut off, right? You don't have food in your stomach, so you're not producing acid, so you keep it shut off rather than try to shut it off after it's already been going.
I see. Okay. Can we take it just after a meal?
No, you can do it, okay, but it's not going to be as effective.
Okay.
And so what you might see is if you have improper usage, the doctor might put you on the medication, say, hey, take one a day when you have symptoms. Okay, so you take it, and then you go back to the physician, say 2-3 weeks later, maybe a month later. He says, Matt, how's it working? You're going to say, well, doc, it's not working. So what's going to happen? He might increase the dose, right? So then same thing. You're taking it still incorrectly, right? So then what happens? He goes back another month later, and they say, it's not working. Now we've increased it to maybe twice a day dosing.
And now you're taking too much.
And now you're taking more than you need to be taking because you weren't taking it correctly from the get. And so what that results in is a bunch of different consequences that we'll get into later that you kind of put yourself more at risk when you don't need to.
With Nexium, can you take this drug for too long of a period of time?
The drug itself, even in packaging, is designed to only be taken for a 14-day period. And typically you see that when you're treating heartburn or in some cases if you're treating a ulceration of the stomach lining, you can take it for a longer period of time. Maximum, you should probably be looking at 90 days. Beyond the 90-day mark, you're looking at using it almost as a maintenance drug, in which case you're not really treating the issue. The issue at hand is most likely either related to diet or some type of, for whatever reason, an ulceration. And so if you're not treating that and that's not healing, then you're using it. Your usage then becomes more of a maintenance instead of a symptomatic, acute, I'm treating this condition right now.
And you want to be taking Nexium longer than 90 days?
By and large, there will be very, very few cases that you would ever want to use it longer than that.
Sometimes people take more than one drug at the time. Are there any drug interaction issues?
Okay, so let's paint this picture for you. You're going to the pharmacy. You're getting other medications there, okay, for a number of different reasons. And then you go out front and you buy something that's over the counter. The pharmacist never sees that. So he cannot detect drug-drug interactions on medications that you're taking that's over the counter along with something that you're getting prescription, because unless it's being filled as a prescription, we never see it. You could come in when the pharmacy's closed, when no one's around. We would never know you're taking it unless you told us.
I see.
So that in and of itself could be problems because there could be direct drug interactions. Okay?
But that's also drug interactions are the duty of the doctor and the pharmacist to spot if they're known to them.
If they're known.
I see.
You may not know it because you might be getting something that's over the counter. So the drug interaction in and of itself is a direct drug interaction, or potentially could be, but we may never see it. And that's one potential issue or concern that you want to stress to your physician. If you're taking something that's over the counter, let them know so that they can then try to pick the drug that's best for you based on that information. So it's important to give them a good history on that. Now, say everything is fine, you get the prescription from the doctor. There are effects that drug can have indirectly on the absorption of other vitamins. So in the case of calcium, you have to have calcium. Calcium needs an acidic environment to have the best absorption. Okay, that's why you see products like calcium citrate, which is basically a form of calcium that brings the acid along with it so that you get better absorption. Okay, so it's the most recommended form of calcium to take for that reason. And so if you have a decreased acidity environment, basically you're lowering the acidic level of the stomach, or the acidity, I should say, that's going to cause problems when the absorption of calcium comes into play, because you won't be able to absorb it as well.
I see.
And so long-term usage, if you're thinking you're using this 5-6 years, you're going to have decreased amount of absorption of calcium while you may be thinking you're using it properly or taking enough.
Well, let's say somebody's received some bad advice or no advice, or they've been recommended to take it too long. What sort of consequences can we see with Nexium?
So Nexium can have some consequences in terms of kidney problems. So you're looking at something called interstitial nephritis, which is basically the inner lining and tubules of the kidney become inflamed, irritated, untreated, can progress into kidney disease. If left untreated or the complication worsens, can result in end-stage renal disease.
Okay. So we've got kidney damages and we've got some vitamin deficiencies. Are there any infection issues with Nexium?
Class-wide, in terms of all of the proton pump inhibitors, there was a literature that came out in 2016 that basically said that these medications have been seen to increase risks of C. diff, which is basically an infection that can run rampant in the GI tract throughout the intestines, cause some pretty rough diarrhea.
How serious can C. diff as an infection be?
Untreated, it can then manifest itself into something called toxic megacolon, which is basically the easiest way to explain it is destruction of the linings of the GI tract.
I see. Okay. Well, how quickly should somebody deal with this if they're seeing some of these repercussions?
Well, you're looking at a kidney situation. You're looking at the constant diarrhea with a very, very foul and distinct smell. It's not going to take you very long to realize this is something that needs to be dealt with pretty urgently.
Now, by urgently, are we talking make an appointment for the next week or month, or we're talking emergency room stuff?
Emergency room immediately.
Okay, I see. Well, Dr. Garcia, it's been a pleasure speaking with you and learning about Nexium. I'm Matt Hamilton. If you want additional information, you should go to our website, worldwideweb.law-kc.com. We have a lot of information that will help with research and links to other areas. You may also check out our YouTube channel for additional videos. Dr. Garcia, it's been a pleasure. Thank you.
Thank you, man.
It's been Drug Era Talk.